Hi, and thanks for taking the time today to listen to our webinar about talking to your child about COVID-19. Morneau Shepell specializes in supporting individuals with coping effectively throughout all kinds of different situations and crises. And as we try to navigate through these difficult times brought on by COVID-19, we recognize the increasing anxieties that you and your children may be facing. It is important to understand how to support our children through these times and help them cope with their fears, stresses, and anxieties that may be caused as a result of this situation. This webinar will help you learn to recognize, support, and address anxiety related to COVID-19. In order to support a child through their emotional and physical reactions to events such as COVID-19, we really need to, get a better understanding whether they're displaying stress, fear, or anxiety. In the next slide, I'll talk about how to differentiate and understand those differences when they're showing signs of fear, stress, and anxiety. So, what is the difference between fear, stress, and anxiety? Fear is observed through physical symptoms such as, for example, sweating, shaking, or crying, and can be a reaction to situations involving real danger. So, for example, if you were on a hike and you saw a bear directly in front of you, or if you were driving and noticed a car coming towards you, in these moments, your body mobilizes itself to react to that threat. And it's something we call the fight or flight response, which you've probably heard about. Stress, on the other hand, are emotions and behaviors that you show during real or perceived danger. There are also observable and physical symptoms similar to fear, such as sweating or shaking. And those sensations associated with stress do tend to disappear when the situation causing that stress is over. So for example, if you have a stressful event like a big presentation coming up, or if you're running late for a meeting, that may cause a physical reaction, such as, increased heart rate, sweating. But then once, the meeting, once you arrive at the meeting or once the presentation's completed, that feeling, those reactions disappear once it's completed. And then finally, anxiety is emotions and or physical symptoms that are associated with anticipating danger, so thinking about what's going to happen in the future, and at times irrational thoughts of danger. So this leads to thoughts that can be exaggerated and extremely intense. And it's pretty important to know that with anxiety, the emotions and behaviors you have aren't usually very helpful to address the situation you're dealing with. So now that we know the differences between fear, stress, and anxiety, I want to shift our focus to recognizing what anxiety looks like. So we'll have a look at children ages 1 to 12. And just before I go on, it's important to understand that anxiety can look differently from child to child, and not all the signs I talk about will be present in each child. With that being said, some common signs of anxiety can include difficulties with sleep, such as falling asleep or staying asleep, waking up at night. Your child may show loss or decreased appetite, and you may notice increase in their worrying. They may, ask to be held more. They may ask multiple questions. They may even ask the same question over and over again, even if you've already provided the answer. They can show physical symptoms, complaining about headaches or stomach aches. You could also see challenging behaviors. They might be more annoyed or agitated, showing frustration, generally not cooperating as much as they used to. And you might see regression in learned behaviors. So, perhaps they're wetting the bed, or just in general, they seem less independent and need you to do more things for them. And you may also see them avoiding particular events or different situations. When it comes to recognizing anxiety in adolescents and teenagers, it's important to know that there is some overlap between them and the signs that are present in children. So some signs for this age include, verbally worrying about their own health or that of, their loved one or family member. They could also avoid certain situations. They may have difficulty concentrating and completing tasks. That might look like avoiding doing their homework, and having a difficult time focusing on that. As it is with kids, it's also younger kids, it's also common to see them having sleeping challenges, changes in their appetite, and also physical symptoms like stomach ache and headache. Those are pretty common. Other signs may include an increase in use of alcohol or even drugs. And finally, you could see a change in their humor, their sense of humor or communication. Examples might be, they're more irritable, or they're becoming more aggressive towards others. And, that might not be something you'd normally see with them otherwise. Okay, now that we're able to recognize anxiety as it presents in children and teenagers, how can we, deal with anxieties related to COVID-19? So there's a lot of benefits to be had from parent and child conversations, and this can be useful to dealing with this current situation. So a dialogue with your child really allows them an opportunity to express their thoughts and feelings about what's been happening. And it creates a secure environment to discuss their fears, and it can help them, have a sense of control of what's happening. Discussions can help your child improve their well-being and also provide a sense of trust in you and your relationship with each other. Talking about COVID-19 can, give them an opportunity to feel more secure during this insecure time, and also help you as the parent better understand what your child needs from you. So when is the right time to have these conversations? The first thing, it might be a good idea to take a look at and reflect on your own emotions and ask yourself, are you feeling ready at this time to have this conversation? So it might be helpful to prepare something in advance, such as, questions you think your child might ask, and have the answers ready. You could use different online resources to support your conversation, and, don't hesitate to reach out to people in your support system if you're unsure of, certain information. And before you start, take a deep breath, recognize where you are emotionally, and then start that conversation. So before you start, ask your child what they already know about COVID-19. This can really help you gear up for the conversation and supply facts that they don't already know. It's important to take time to decide how much information you want to share, and just, make sure the information you're giving to them matches their age and, the level, like what developmental level they're at. So for a very young child, using pictures or images can be really useful to really help them understand the information. While, with your teenager, you might be able to share actual articles online, and those can be a great tool. It's pretty important during that conversation to focus on the solutions rather than the scary information, to avoid increasing any intense what if thoughts that they might be thinking. So for example, by focusing on how to wash your hands properly to get rid of germs, you might help them reduce the worries about what might happen if we catch those germs. So when talking about COVID-19, try to remain neutral and limit your emotions as much as possible. Children are very receptive to emotions, and they can be really greatly influenced by your emotions. Also, try to limit the amount of exposure your child gets to news and media. It's pretty hard to do. We're all wondering what's going on, and it's easy to be exposed, 24/7. But having your child, be exposed to that, constantly can really increase their anxiety. It is important to, keep up to date with what's happening, but try to, provide only the most relevant facts that relate to your family and your child when you're talking with them. Make sure to explain the situation in simple terms and avoid, complicated medical jargon. So for example, with a young 4-year-old, you may say something like, oh, lots of places are closed because there's a virus called corona making people sick, and we're trying to avoid it. It's a lot like the flu, and we have to stay away from others right now to avoid those germs. But we can wash our hands a lot to get rid of the germs that could make us sick. So using language like that can really help them wrap their heads around what's happening. And if you relate this to an actual experience they've had recently, like if they were sick with the flu or cold, that can help them better understand even more what the situation really means. It's really important to stress good hygiene. You can use images or videos showing people properly washing their hands and practicing social distancing, and this can also help them better understand. Talk to your child about how to recognize their own emotions and that those feelings are normal and an expected way to feel during this time. It's okay, you could say it's okay to feel scared or feel worried, and try to give your child praise for recognizing and naming those feelings. That can be very useful. It's important to tell your child that although COVID-19 can be scary, that there are some really incredible community members out there working hard to ensure the safety and well-being of the population. It's helpful if you can name some of those people. You might mention doctors who are giving out treatments, or researchers making vaccines, nurses who are helping patients, and people in general who are actively fighting the situation. Try to be honest and avoid pretending that nothing's happening. Your child's clued in to some degree, and if they have incorrect information, be sure to tell them the facts and keep them updated. It's okay not to have all the answers to the questions. Let them know you're going to do your best to research and find out, and that might be something you could even do together and go online. Again, it's really key to focus on solutions rather than the crisis, to help reduce any exaggerated thoughts and worries they might be having. Okay, so creating and maintaining a daily routine can really help ground your child and give them some security during this very unstable time. Try to give your family some grace time to adapt to this new situation. It's not going to be perfect, and it's going to take some time to figure out, but when it's possible, try to introduce, a new routine at home. So, it's all about finding your own groove. It's easy to do this by structuring, routines around meal times, 3 meals a day, 2 snacks a day. And, trying to do those things at the same time every day, as well as trying to incorporate activities they enjoy, reading a book or, going for a walk. So try to, be structured if you can. That makes them feel secure. And beyond the routines, encourage your child to be flexible and creative, allow them to make a mess, and use their toys in different ways. Just keep in mind that they're coping with all these new restrictions just like us, and they need some kind of outlet of freedom. So try to spend time as a family, plan activities where each member can choose what to do. And take a moment to appreciate that extra time you get to spend together. This can also, be helpful to manage your own emotions as a parent during this time. So next, I'd like to talk about the different supports, interventions, and strategies that you can use to reduce anxiety in your children related to COVID-19. So first, you want to support your child through the physical symptoms they are experiencing due to the anxiety. So you want to help them recognize and label their symptoms. I would suggest using an online visual tool if possible. And once you can identify that, you can then go on to teach them relaxing or calming techniques that can allow them to relieve those symptoms. And there's lots of things online, but just a few ideas are, meditation and deep breathing, yoga, using muscle contractions, even, getting a glass of water or going for a walk. There's lots of different resources. And, make sure during the entire process that they're labeling their emotions and their symptoms. Like, I'm feeling scared and, my chest feels really tight. All right, let's take some deep breaths. So recognizing these feelings can help you as the parent establish, okay, this is now the time to do some treatment or, use some kind of intervention approach. So after you get through physical symptoms, it's important to then tackle their anxious thoughts. So the goal with this part is to change your child's inner dialogue, which could be a negative, to a more positive one, and that can reduce the anxiety. Support as much independence throughout this process as possible. So having them identify those things and verbalize. So have your child connect and recognize their thoughts, identify that they may be, inappropriate or not rational, and then support them to develop positive thoughts. So throughout this process, avoid minimizing your child's emotions. So if they're complaining that, if they're expressing that they're feeling scared, instead of saying, oh, it's not really that scary. So instead of doing that, rather validate their emotions. Like, oh, you feel scared. It's okay to feel scared. And, support them throughout that. So you want to help your child interrupt those anxious thoughts and now replace them with more appropriate and positive ones. This will make your child feel more secure and calm them down. There are 3 steps to support this type of intervention. The first thing you do is have your child identify their negative thought by first saying it out loud. So for example, what if we can never go outside again? And then secondly, we would confront those negative thoughts. For example, well, how likely is that to happen? What's the evidence for that? Is that really realistic? And then finally, you would replace that negative thought with a more positive one or more appropriate one. So for example, well, we might have to stay inside for the next while, but not forever. And in the meantime, there's a lot of wonderful people working hard to fight COVID-19, and now we might have some more time to spend together as a family, and that's sort of a positive thing we can focus on. So you want to help your child apply these steps of problem solving to help reduce their anxiety, throughout the day. And it's also important to recognize what's actually causing the anxiety. You don't want to assume that they're feeling anxious because they're worried about catching germs or, directly because of COVID-19, but rather because they're stuck at home, they're bored, they're not going to school, or they miss their friends. And those are all different reasons why they could be having these symptoms of anxiety. So from there, like once you identify that, you can come up with different solutions to support them through it. And together, both you and your child should be coming up with those solutions. If they're bored, then, what's something they can plan to do later this week that's going to be something that they can look forward to. And then, together you can evaluate the advantages and disadvantages of each solution and then evaluate the results. I was bored, and then we planned to do, build a fort on Thursday. Did that work? Were they less bored? Did they feel less anxious? And so you try those out, and then if it didn't work, then, try a different solution and come up with those, and keep trying until you find one that works for you and your child to help reduce their anxiety. So lastly, we want to be resilient, and in time teach our children to be resilient as well. It's important to recognize that knowledge is really key, and we should continue to strive to learn as much as we can about what's happening. This can really help us tackle different situations. And also, it's important to confront fear head on. The more we practice facing fearful situations, the better prepared we are to deal with fearful situations appropriately in the future. That goes for us as parents and our children. And to better understand our emotions and resiliency, ask questions, research solutions together, and encourage your children to do the same. Finally, focus on some positive aspects of our position. We're all at home now, and take the time to laugh and really appreciate each other. So you may try all of these strategies and they may work. However, if you're finding that your child's anxiety isn't improving, is, continuing to impact them negatively every day, or in general is just difficult to contain, it might be time to consult a professional. So it's key to know that without proper treatment, anxiety can become worse. So right now at Morneau Shepell, we are offering online services to accommodate our clients. And if you feel like you need support, please contact your Employee and Family Assistance Program now. So we hope you found this webinar helpful and a support to you and your family during this challenging time. Thanks for listening and stay well.